So when you typically look at a globe or a map or the world, you think, man, I'm just one tiny dot. Just one person in this great big landscape, right? That's typically how you feel. I'm just in a sea of millions and millions of people. So my voice doesn't really matter that much, right? I'm going to tell you about your colleague and my personal good friend that I got to get to know through the AMA's campaign school. This is Dr. Suzanne Harrison. Dr. Harrison went through the campaign school. AMA trains you, teaches you fundraising, teaches you how to manage a campaign, teaches you questions that you might get asked. And so she did this program with her husband, and that's how I got to get to know Dr. Harrison. She's an anesthesiologist, 3 beautiful children, decided to run for office. And I want you to know that the first time she ran, she lost by 3 votes. 3 votes. Now think, if you were her partner or her colleague, or you worked with her at the hospital she worked at, how would you feel if your colleague lost by just 3 votes and you thought, well, it doesn't really matter if I vote or not. What difference is that going to make? Well, to her, that made the difference of having a physician voice in the Utah General Assembly, so that was a very big deal. In positive news, Dr. Harrison actually is a member of the Utah General Assembly now, and she won by 2,000 votes when she ran again, so her colleagues came out and supported her. But my point in sharing that story with you is that you do matter, and advocacy and showing up and physicians being present does matter. So you probably think day to day that this is what your life looks like, right? I just go into work, I'm thinking about taking care of my patients, and that is my laser focus. But advocacy touches everything, right? We're changing how healthcare looks in North Carolina, going to a value-based system, transforming Medicaid. All of those would be better off, right, if we all had a little bit of input, or physicians had input. I'm only the communicator of that message, but you telling me what that message should be and how we should make it better, right? And the public thinks so too. We heard a little bit at lunch about the public's input on what they think about medical professionals, and they trust you. According to a Pew Research survey, 84% of the general public, so general average Americans, believe that medical professionals with a science background act within the best interests of the public most of the time, right? 84%. Now that number is reversed for politicians. Not surprising, right? We don't have much faith in our politicians, but right, that highlights the importance of why you need to be involved, right? If people have that much trust in you and they don't trust politicians, they need to have your input and your voice in order to make good decisions. So let's talk a little bit about what the landscape looks like in North Carolina. So out of 170 members, how many physicians do we have in the General Assembly? 1. Dr. Perrin Jones, who has just replaced Dr. Greg Murphy in the General Assembly. So out of 170 people who decide what your life looks like, much of it day to day, only 1 person knows what it's like to be in your shoes. Now granted, that's not to say we don't have 3 nurses, a pharmacist, a dentist, a veterinarian, and a few social workers, but in grand total, that's less than 10 people who see patients or know what it's like to see a patient every single day. So again, highlighting the importance of your participation really matters. Now, that first participation process, you're like, okay, Suzanne, I get it. I got to show up. But it first starts with voting. So to give you a little background on what voting looks like in North Carolina, in 2016, our voter turnout was actually the highest, almost the highest that it has ever been. So out of 6.9 million registered voters, we had 4.7 million voters turn out. So that's almost 70%, give or take. The only time that it's been that high, or almost that high in 40 years, was in 2008. So still, out of all the number of registered voters in North Carolina, a very small percentage are actually showing up to vote. Now, granted, this is a presidential election. Those numbers are much smaller in a primary election and then in a municipal election. This is my fun fact that I decided to throw in today. In Raleigh and in Cary, there are 10,000 people that have voted in our municipal election that's occurring right now. But how many people showed up to the new grocery store opening? Over 30,000, that's right. So only a third of those people who showed up to that grocery store opening have actually voted, which really breaks my heart personally. But that's the reality. And the numbers are actually much worse for physicians, I'm sorry to tell you. You are 9%, according to a Time article, 9% less likely than the general population to vote. I'm going to let that sink in a little bit. Maybe I'll say it this way. You are 9% less likely than the patients you see to vote. What? Right? I needed the audible gasp. Okay, maybe this one. You are 22% less likely than your other highly educated counterparts, attorneys, to vote. Right? No surprise. But how do we get this number up? And I think that the Medical Society can play a vital role in educating you on why it's important, but also some ways for you to be involved. So I decided to create a survey as a part of this project to survey our membership. Now, granted, we sent out an email survey to all of our membership and got about 185 responses in total, which was pretty good for no incentive, according to our communications staff. They said that was a great response, so I was happy about that. Just a 6-question survey, and I recognize that that's very short, but you all know that physicians, if I made it any longer than that, may not respond. So that was the intent on keeping it short, and I hope that I can do some follow-up surveys. But first I asked, are you registered to vote? And 99% said yes. Now, while that's great, I've done my own kind of survey when we have groups of physicians coming to the Medical Society, and most of the time we always have amongst a group of 30 or so, at least 3 or 4 that are not registered. They may be registered in another state. And I also had 99% in my second question say that they are likely to vote in the next election. And while that's good, I'm glad that you all are registered and want to vote. I recognize that as kind of a little biased. So maybe we need a follow-up survey on looking up the people who actually responded to the questions and seeing if they actually are registered. Maybe a better follow-up survey question. But 99% on both of those first 2 questions. The second question I asked is, what motivates you to vote? So what can I communicate with you, right, to encourage you to vote or participate in this process? And not surprisingly, you all said issues, right? What's affecting your medical practice life day to day is what motivates you to vote. So I found that as good news, right? If I'm better communicating laws and bills and things that are being discussed and filed, that is a great way to motivate you. My second 2 questions were about White Coat Wednesday. The first one was, have you participated in White Coat Wednesday before? And about a third of my responses said that they'd have, which that's a large majority that have not, right? So that's a big opportunity space for me. And my second question in that series was, how likely are you to participate in a White Coat Wednesday in the future? And half said that they would like to participate. So I see that as a big opportunity for growth for us in our advocacy program, since that's something we're expanding and doing every single Wednesday, which I'm very proud of. So then I said, well, I'm going to leave this question open-ended. And our communication staff kind of looked at me a little funny of, why did you leave a question open-ended? And I said, well, I just want to see what people will say, right? You give people an option to respond. And I had 120 of my 185 responses respond to this question. And that's a lot. That's a lot of input. And that also told me that we need to be doing more of soliciting input from our members. So I'm really glad that I used that tactic. So I asked, what additional NCMS advocacy resources would be helpful to you, right? So the first response overwhelmingly that I got back is, we love the weekly Friday video. So again, that says to me, great, we're going to keep doing more videos. That's going well. The next was, we love the blog. That's a great way for us to get information, to look up bills. I love the links to the bills so I can read the full bill and the categories. So that was great too. We summarized every single bill that touches healthcare. And they also mentioned our action alerts are a great way to participate in a grassroots type of manner. So I'm very excited that those are 3 things we've really focused on in this past session and will continue to focus on. So these are a few of the responses that I liked that link to those things that I just mentioned. But some growth areas, I like to say, because we don't want to say negative, right? Some growth areas were, we need to make information shorter. You need to make morning rounds shorter. You need to make the morning round summaries of the bill shorter and the bill summary shorter, which I was an English major, so guilty that sometimes I write a novel and maybe I shouldn't. So that's something that we certainly can improve. And the second one suggestion that I really liked, that I had thought about doing, but I love that it was recommended by one of our members, was doing a road show, right? Us going into your community, to where your legislators are, and meeting and talking with you and them, and having a sit-down conversation with legislators in their district with you being there. So I really hope, if we ever get out of session, right, that I'll be able to do that and host some local events. So these were some of the growth areas. A concise summary, I like that in all caps. I'll do better, I promise. Some candidate profiles, and again, the roadshow. So in closing, I'd like to say that you all represent the future of North Carolina, right? Like, you have the ability to impact what healthcare looks like moving forward. And that is such a powerful tool that I do not want our members to waste, because I think you really can make an impact, and I do think it depends on you. Thank you.